We are going to kick off the clinical breakout session here with another person that really kind of helped get me started on this journey, Kathy Gerwig. I first learned about Kathy when I was attending the University of New Mexico's Project Echo Climate and Health course, which if you're looking to kind of build a foundation beyond what we were talking about today, all their lectures are recorded. They had a 4-year series and have restarted the series this spring that really had some amazing foundational lectures. And Kathy gave a 2-part talk about sustainability in healthcare that really opened my eyes to the idea that I could make a big impact locally and directly through my work. Because I didn't realize just how impactful healthcare was on the climate until I heard Kathy speak. She is the author of what I really consider the best book on sustainability in healthcare called Greening Healthcare: How Hospitals Can Heal the Planet, which highlights the vital role of healthcare in tackling climate change. She's currently serving as a pro bono senior advisor to Healthcare Without Harm, leading efforts to cut healthcare's greenhouse gas emissions. She's also a member of the National Academy of Medicine Action Collaborative on Decarbonizing the Health Sector and serves as faculty for the Institute of Healthcare Improvement's Safety Net Decarbonization Collaborative. She is on the executive committee of the Collaborative for Healthcare Action to Reduce MedTech Emissions, which is CHARM, which has a lot of great information on their website about reprocessing devices that we should all take a look at, and we'll learn some more about today, and was the series advisor for that ECHO Climate and Health Education project I mentioned. Kathy comes with serious chops. She served in national executive roles during her 26-year career at Kaiser Permanente as VP and President of the Environmental Stewardship Office. She was responsible for enterprise sustainability at Kaiser Permanente, widely recognized for reducing emissions and waste while supporting healthier, more resilient communities. Please welcome Kathy Gerwig.
Thank you. Thank you so much, Ethan. I'm super delighted to be here, and it has been a fantastic conference so far. I've been able to listen in and really appreciate the deep content. And so I'm going to assume you can see slides and hear me and that everything is working beautifully unless somebody hollers. So feel free to holler if anything's not working. But what I wanted to do today is talk about the role of the delivery of healthcare. But I'm actually going to start by posing some questions that I hope you'll contemplate during the course of this session. And I'll remind you of these questions at the very end. Because I would love, in addition to some Q&A, to actually generate conversation among you all about this topic. So here are my questions for you. What responsibility do physicians have in mitigating environmental impacts? How do you think about the principle of do no harm as it applies to climate change? And what adaptations should physicians make as they address evolving health risks related to climate change? So I would love to hear your thoughts on those topics. Just in terms of the learning objectives, what I'm going to be talking about is the relationship between climate change, health, and the delivery of health care, and the role physicians can play to address those health risks. So it was a great morning, and you've already heard all about this. So climate change is a health crisis, and I'm not going to repeat what you heard earlier, but I wanted to pull out a couple of things that I did not hear specifically mentioned. So first of all, on air quality, the case has been made that there is a connection between climate change and air quality, meaning that as we have warmer days, that worsens air quality. But the other thing about air quality that is great from a physician perspective is that when you don't burn fossil fuels, when you're not combusting fossil fuels, that not only supports climate action, but you get immediate results in terms of local air quality. So for folks who don't want to take climate action, or in communities where it's not welcomed to have a conversation or with people around climate action. Everybody wants to talk about air quality, and especially how poor air quality can affect children. And if they're near highways or ports or other places where the fossil fuel combustion is particularly severe, these are huge opportunities to have a direct impact, and you can take climate action without necessarily thinking about it in that way. The other thing I wanted to point out is around the food and water contamination and food scarcity that results from climate change. And I think others will be talking about that later too, but the piece I wanted to pull out of there that I didn't hear discussed already is the degree to which these lead to civil unrest and war. And so those are outcomes of climate change that have to do with something as basic as wanting food to eat. So let's move on here. I mentioned, what do no harm can mean. And as we heard from speakers earlier, climate change is especially impactful for those who are more vulnerable for any of the reasons that you see on this slide that others have really talked about so well. But I think, again, the piece I would pull out of here for attention is that it is preventable harm. So climate change is human caused, and humans can have an impact in mitigating it, adapting to it, and helping others understand it. And in that way, if you think about it as preventable harm that you as clinicians are able to impact, then it's maybe a different framing. This is one of many tools. Others have been introduced today that I find really helpful. Lots of resources today. The main reason I'm showing this is not to focus on the actual high heat days that are projected, but to say of all the resources you're going to learn about today, I would just recommend that you think about how to incorporate forecasting in the practice of medicine. So if you're aware that over the next 5 years, perhaps, that there will be more higher heat days in Boise, then that is something that you can act upon in your practice. You can prepare for it, as others have introduced, but using this tool or many others, being aware of what's coming and being brave enough to look at what's coming based on current projections, and to then inform how you proceed in educating your communities, your patients, yourself, is the piece I wanted to pull out there. So let me talk about how healthcare is part of the problem. So climate change is certainly a problem, and healthcare, if the global healthcare sector was a country, it would be the 5th largest emitter of greenhouse gases. So we're a huge part of the problem, and all of you in the room can impact that in a positive way. Just in the US sector, healthcare is responsible for about 8.5% of greenhouse gas emissions in the US. And here's one that we're going to dig into a little bit more, which is that 20% of greenhouse gas emissions come from facilities and operations. A lot of the work that they're talking about in the other breakout relates to that 20%. But we're going to focus more on the 80% of emissions that come through the value chain. And by value chain, that includes both supply chain and investments. And I'll mostly be talking about supply chain. So this is how, when we say healthcare is culpable in creating the gases that result in climate change, this is what we're talking about. We can make very meaningful changes on a global scale by addressing opportunities within the healthcare sector. So just to get into the brass tacks a little bit for a review for some of you and maybe some new information, you might have seen charts similar to this one, but I wanted to take a moment to just make sure we understand what it is we're talking about with greenhouse gas emissions. So up at the top of the chart, you see the various greenhouse gas emissions. It's methane, it's nitrous oxide, it's carbon dioxide, of course, and then fluorinated compounds. We talk about CO2 and carbon as the big issue. It's really all of these areas that are big issues. And one way they're measured in sort of a common way is we talk about carbon dioxide equivalents. So when you see a little E on the end of anything having to do with carbon dioxide, it means they're probably talking about not just carbon, but other emissions. And this is important for healthcare because healthcare is responsible not just for carbon emissions, but for some of these other emissions like nitrous and methane. And this particular chart I like, it was put out by the NHS in the UK. And so scope 1 is the direct stuff. It's the burning of natural gas in a facility to heat and cool it. It's the lighting. It's what it takes to operate the facility. And it's also fleet vehicles. One particular medical component of that that's of interest, and you'll have a speaker on it later, is around anesthetic gases. So that's all scope 1. Scope 1 is important because you have direct control over what happens at a facility. The owner of the facility, the physicians practicing in a facility can directly impact scope 1. Scope 2 is purchased electricity. Again, I think the other breakout group is going to talk about how important it is to invest in renewable energy, off-site wind power, solar power, geothermal, et cetera. So again, controllable because every owner of a facility can decide how they're going to buy their electricity. So those are the two that get a lot of focus, rightly so, because we control it, so we have to act on that. I bring it up with this group because knowing that means you can be advocates. So it's not just the facility engineers and the folks who run the operations who need to advocate for taking action in scope 1 and scope 2, you can be powerful influencers of that. So having knowledge about what you're talking about is an important part of what I think very positive actions that physicians can take. And then we have the big scope 3, and this chart is to scale. And in scope 3, again, NHS has done this really well, where they show the medical components really of this indirect emissions. So earlier I said about 80% of emissions come from the value chain. And you can see what we're talking about here from a supply chain standpoint are medical devices, medicines, medical waste, meter dose inhalers, which we'll also have somebody speaking to later. So these are it's called indirect. Scope 3 is called indirect because you don't directly control the carbon that comes along with the products you buy. Carbon is embedded in devices when you purchase a medical device. You're buying carbon that has come through the sourcing of raw materials and the packaging and transportation. So, but you can influence it. And that's what we're going to spend some time talking about here. And then I'll just mention it because it's on the slide. On the far right, travel is outside the greenhouse gas protocol, which is the global standard for how we think about greenhouse gas emissions, and things like patient and visitor travel are not included in any of the scopes, and actually neither is telehealth, but they're very important areas to that offer opportunities for reducing greenhouse gas emissions. So let's talk about how care delivery is actually burdened by climate change. This is one of those things where it's not just that people are getting sick from climate change, it's that care delivery is being impacted in ways that mean that the places people need to go to when there's a catastrophe, when they have a health issue, are negatively impacted by all of the things we've been talking about: wildfires, floods, et cetera. So I wanted to spend a moment on exactly how that happens. So let's talk about infrastructure. We know back from Hurricane Katrina that hospitals were taken down because of floodwaters. In wildfires, I mean, I was with Kaiser Permanente in 2017 when, the first hospital in this country that was ever evacuated because of a wildfire was in Santa Rosa, California. And it was a shocking and surprising occurrence that really overwhelmed the capacity of healthcare in the entire region, not just at that facility. I mean, what happened there was that all the patients were safely evacuated, but it was very much an in-the-moment emergency response. Shortly thereafter, plans were put in place to say, should that ever happen again, we're going to be in much better position to protect the infrastructure and be able to provide capacity for providing healthcare. But the fact is, the very next year, in that very same community, there was another wildfire. And yes, the health systems were much better able to respond to it and proactively evacuate patients. But it just goes to show you how quickly this has all come about from 2017, when it was very much a shock, to today, where you can't find a hospital in a wildfire area that doesn't have a really solid plan in place. So having the infrastructure impacted, not just for wildfires, but hardening, we see coastal cities where hospitals are being hardened and medical facilities being hardened through physical changes. That is in response to the fact that these things are being impacted. And then supply chain disruptions. If you tracked with the superstorm Helene last year, which was very devastating, there was a Baxter plant that was responsible for about 60% of the saline bags being used throughout the country. And that plant went down because of Helene. And that was an enormous supply chain disruption, not the first disruption for IV bags in this country due to a climate-related event. We've seen them before, but that's really the most recent. And it just goes to show you that who knew 60% of the saline bags were coming out of one facility that was actually being impacted by something like that storm. So understanding more about the supply chain and what it takes to have a resilient supply chain is an important part of addressing this very important burden that care delivery faces due to climate change. And then the last item I wanted to mention is the impact on staff. And I really appreciated the earlier session about mental health, and that is hugely important to staff. Also, I mean, people who are responding to these crises that happen more and more frequently, whether it's a heat wave or a wildfire or whatever is in your area, the staff are dealing with their own issues, with their own families during a crisis. In fact, the Santa Rosa fire that I mentioned that happened in 2017, the two people who were in charge of operating that facility during that emergency. One was the physician in chief and the other was the administrator in chief. Both of them lost their homes during the time they were at the hospital managing that crisis. They were also dealing with the fact that they were learning their homes were lost, didn't know immediately where their families were. And that kind of impact on staff was very much in the moment. And then, of course, as you heard from the speaker on mental health, the ongoing kind of trauma from that in entire communities is huge. And so how staff are impacted, yes, maybe they need, it could be anything like a home loan or hotel rooms or clothing. I mean, some of the same things you think about a community needing that's impacted, the very people who are providing care in those circumstances are also impacted, again, not just at the time of the event, but ongoing. So these are all ways that care delivery is significantly impacted. So I love talking about this because it is a way to really change the tables. It's not just, taking action to solve a climate problem. It's that the actions you take to reduce greenhouse gas emissions actually improve health. And if we think about we're doing these things, I mentioned the first one earlier when I said the connection with air quality is so great. Climate action, reducing fossil fuel combustion, makes the air easier to breathe. And that is an enormous benefit. And this slide goes into some of those details. Also, the increased energy security. So if you have renewable sources that are not as polluting, like solar and wind or geothermal, then you're getting better energy security. So your power will not go off because your power lines have been shut down by the utility to try to avoid additional wildfires. That kind of security really, it necessitates battery backup. And so there are issues along with that. But just appreciating that where the energy comes from, how resilient it is, and is it able to withstand crises that would otherwise shut down the energy security? These are all reasons, great reasons to take climate action. And food, so I mentioned food scarcity earlier as a downside of climate change. And so the ways we address that are to focus on reducing meat, have plant-forward diets, and to the extent that those relate to health benefits, like health benefits in cardiovascular disease, those are things that are improving public health and reducing greenhouse gas emissions at the same time. And then the last one on the chart is around transportation. And you know that active transportation, where you can have bicycling, walking, anything other than driving alone in a gas-powered vehicle, can improve health and cleans up the air, which gets back to healthier air to breathe. And by the way, it significantly reduces greenhouse gas emissions. So you don't need to look any further for why to take climate action than to say, for all of these reasons, it is the right thing to do from a medical perspective. You know, the thing that I think is most exciting about this work is that it is an enormous opportunity for physicians to drive better care delivery. So there's enormous waste in healthcare, and waste causes greenhouse gas pollution, and that causes catastrophic climate change. So by prioritizing high quality, high value care that is not wasteful, that gives the right care to the right people at the right time, that reduces greenhouse gas emissions. The second item is focusing on prevention, not just treatment. Yes, we absolutely need treatment, but as we think about preventing illness, and you track that blood sugar in a patient, and as you see it getting higher, you take actions with that patient to prevent it turning into diabetes, for example. Because when people are healthier, they don't cause as many greenhouse gas emissions in the care that they receive. So, to the extent that we can prevent illness and disease, that is one of the smartest ways to reduce greenhouse gas emissions in healthcare. And it means people are living healthier lives and their quality of life is better. The third item on here is to link this work to quality and safety initiatives. So quality care, is safe care. It's the right care. It's high value care. But the groups of people who talk about climate action in healthcare and quality healthcare are often not in the same room. So one of the challenges I would make to you is, to the extent you can help cross those communication barriers within your own work and talk to quality people about the ways in which this work improves quality care. And the Institute for Healthcare Improvement has done some work in this area and has some research sources on their website. But there are some fantastic examples of quality leaders who have embedded some climate action into their quality improvement programs. And some of the early learnings of that just in the last couple of years are that folks who are involved in that work, maybe they come for the quality, but they stay for the sustainability because that gives them joy. They feel like they have purpose. And so they were able to weave that together, quality and climate initiatives. So that's a huge opportunity. And then the last one around championing lower carbon care, we are going to talk more about the opportunities to do that in just a moment. So I wanted to focus in on supply chain and talk a little bit more about what that is. So what you're looking at here is a chart that the punchline is about half of emissions from a typical hospital in the US go to purchasing goods and services. The things you buy, I think about it kind of like a food chain where, the little critter gets eaten by the bigger critter and all the way up to you're up at the top of the food chain. And what's happening along the way in that food chain is concentrations are getting more and more and more until they're in the top of the food chain. Same with supply chain. Think about the carbon from mining the raw materials into manufacturing, into transportation and distribution, into the use of that product, and then at the end of life of a product. At every step of the way, carbon emissions, greenhouse gas emissions are getting created and embedded in that product. So what you buy matters, how that product is made matters. And so this is in terms of the scope 3 emissions. You can see I've got the blue bar is purchased goods and services. There's a little over on the left with capital goods that are purchased. Same idea applies to them. I did want to take a quick moment just to point out investments. So that's the green bar bottom right on this chart. And I'm only bringing it up, not to focus on it, but to show you the significant impact that investment portfolios can have in a hospital's carbon footprint. And this is because, just like with goods and services that you buy, stocks and investments that you make with, whatever investment portfolios the facility has under its control, those investments result in a company taking certain actions on how they make their stuff. So if you invest in a coal-fired power plant, you are helping that power plant to create emissions. Whereas if you invest instead in renewable energy, you're having the opposite impact. And this goes with absolutely everything you invest in. So there's a lot of commonality, but that's really all I'm going to say about investments, because I do want to focus on supply chain where physicians, clinicians, others in healthcare delivery can have a huge impact. So again, the things that are in that blue bar include pharmaceuticals, chemicals, medical equipment, services, the non-med equipment, as well as capital goods. So I thought I would just take a moment to maybe address what some of you might be feeling in the room, given some of the dire predictions. Is it already too late to take action, and will my individual action make a difference? And I think we've heard a lot today about how it can't be too late, because if we do nothing, then for sure the impacts will happen much faster and will be much worse, not just for future generations, but for this very generation. So it is not too late. Absolutely everything that we're doing to reduce carbon emissions matters. And will your individual action make a difference? I know when you're dealing with a global problem, it can seem like, well, my one little thing matter. Well, I would just look at all of you in this room. And Ethan talked about, when we met back some years ago through an eco session, and, through his initiative and charisma, he's able to pull together this group today to talk about what you can do in your local community, in your own practice, but also more globally if you want to. So there's so many examples of individual action that anybody, introverts, extroverts, people who are surgeons, anesthetists, nursing, everybody can make a difference. So how would you figure this out? Well, I love this site and recommend you check it out. It's called Choosing Wisely Canada, and it is a national in Canada initiative that is focused on, really their aim is to reduce unnecessary tests and treatment. So really focusing on high value care. And, in part, they're doing it because those unnecessary tests and treatment expose patients to potential harm, consumes a lot of resources unnecessarily, and contributes to climate change. So that is their reference going into this. And they worked with clinician societies to identify and develop recommendations on frequently overused tests and treatments that don't add value to patient care. So when you hear folks talk about high value care, in Canada, they've actually gone through to define what that is. And it allows care providers to adopt recommendations, change practices. And so I just happened to pull this screenshot on internal medicine, but they have specific recommendations for dozens of specialties, for general practitioners. So it's a really deep bench of recommendations. And as you can see, excuse me, from the screenshot, they put a little green leaf when it means that it also can support climate action. So if you're wondering what you can do in your practice, and this is where I get to do just a very brief soapbox, because if any of you have done this, you walk into any kind of clinical setting and you chat with staff about ideas they might have for reducing their carbon footprint, often what will come up has to do with recycling. We could do more recycling, we could do double-sided printing, we could do things that are very much at the end of the pipe. Those things are important, but they're not going to solve the climate crisis. And getting people to think instead about the work you do, the healthcare you deliver, and delivering it in a different way. That's what takes you way upstream. That's what gets you into the supply chain to be able to say, I want different supplies. I want to use those supplies in a different way that supports high value, high quality care. And finding those actions within your own practice is really where the greatest satisfaction from this work is going to come from, and also the greatest contribution to climate action. So that's one reference. Choosing Wisely Canada. And then another one I like is this one put together by Healthcare Without Harm, Practice Green Health, and IHI, the Institute for Healthcare Improvement. And they're looking at three things: waste anesthetic gases, meter dose inhalers, and circularity. And it's sort of it's a prioritization tool. So you're a clinician and you want to decide what might be appropriate in the work I do, in the facility I work in. And it takes you through kind of a decision-making matrix. And so you go through that matrix, and then it actually, you can see it if you visit the site, but it takes you out to what are the actions you could take, and what is the likelihood that given your situation, you could actually get some traction there. So it's another way, so if you look at the Choosing Wisely Canada, it's like, wow, there are so many things I could be doing. This is a way to say, okay, of those things that I'm intrigued about, what might I actually be able to do in my practice? So that's another tool to recommend. So I know not everybody works in the operating room, but you can't talk about climate action in healthcare without focusing on the operating room. And I would urge you, even if you don't have anything to do with an operating room, that your knowledge about the opportunities there can make you a powerful advocate. And the reasons that we focus on the operating room are that they use enormous amounts of energy. They often have specialized ventilation and lighting and cooling, and the amount of waste that's generated in operating rooms is just enormous. It's a significant amount of any waste footprint. And they are, ORs also account for about a third of a hospital's expenses. And so it's where a lot of money is, and it's also where a lot of revenue comes from. It's where a lot of waste is generated, and it's where a lot of greenhouse gases from energy use are generated. So it's also where anesthetic gases are used, and their global warming impact is enormous. And again, you'll hear more about that, I think, from another speaker. So I just wanted to pull out a couple of things here because I had a physician say, what do I need to know about HVAC setback? And I think you just need to know enough to know that all it means is the amount of air changes in an OR. And often ORs are built with outdated air exchange specs, and that wastes energy. So if it's optimized, it's a very easy way that does not compromise care in the least, and it has great carbon benefits. So that's what you need to know just to be able to be an advocate. Another one I'll mention down on the lower right is OR kit reformulation. And what that means is, you know, you're in an operating room, surgeons have specific needs that they want out of a kit and tray. It gets opened up and materials go unused and sometimes just even unopened. And so reformulating kits to get rid of the waste and say, we're gonna, you know, what do we use 90% of the time? For the things we use once in a while, it doesn't have to be in every kit. It just needs to be available, and we need a process for that. So these are, I think, some of this is the low-hanging fruit, and we're going to talk more in a minute about reprocessing and a couple of other things. But if there is not action in the operating room in the hospital you're affiliated with, this is a place to start. There are Practice Green Health has all kinds of resources on greening the OR, very specific information on how to proceed. I love this slide. This, at a Boston hospital, the sustainability team conducted a 24-hour audit of one patient unit, and they collected all the waste. And this is a picture of the end of that 24 hours. You know, when I think about, can one person make a difference on, like, this team really, you know, got their hands dirty, literally gloved hands, but they got dirty. And so what they found is that about 75, well, I'll show you in a moment what the actual plastic breakdown was, but what we know is that 75% of plastic waste ends up in landfills. As much as all of us think we recycle well, even if you send it to a recycler, 75% of plastic waste ends up in landfills, and it contaminates all major ecosystems. And has adverse effects on human health, of course. Plastic production is actually increasing, and it accounts for nearly 12% of global oil use today, and that, of course, generates greenhouse gas emissions. So 12%, I'm like, well, okay, it doesn't sound like that much for all that plastic. But here's kind of the frightening thing. Earlier, a speaker mentioned that even oil companies are saying that fossil fuel burning results in climate impacts, that they've gone further than that. Major oil companies not to name names, but anyone you can mention will be on the list. They are investing billions of dollars today in petrochemical plants to produce the raw materials to make plastic. It is a strategic move on their part because they want to ensure continued demand for the products, even as the energy sector moves away from fossil fuels. So as part of that strategy, the petrochemical companies are targeting healthcare as a place that uses a lot of plastic. In fact, because of COVID, we got back into a lot of single-use plastic, and they're banking on that. So I would urge you to just have big red flags up about use of single-use plastic, knowing that you're going up against the petrochemical companies that are the same groups that led us astray on climate impacts in the first place. Just as a quick follow-up to that last picture of the guy standing with all that waste, this was interesting because 70% of the plastic waste they found was PPE. And so that means the gowns you use, the gloves you use, the masks you use, all of that PPE that goes into waste results in those bags that we saw. So how can we think about working with that a bit differently? So these are actions that you can take to reduce plastics and waste. If you do nothing else, focusing on single-use plastics and other kinds of waste in your care delivery work is kind of the highest order of action at that work level. So prioritizing reusable supplies, linens, and equipment. And I think someone will be talking in a moment about a reusable gown project, which is so fantastic. And I'll call out here that one of the big barriers is around myths that the single-use items, particularly single-use plastics, are better from an infection prevention standpoint. And the studies just don't back that up. It seems like, okay, I take it off, I throw it away, no more germs. And the fact is that infection prevention standards are way behind the times, and there's some information that shows that actually people get a false sense of protection if they're using disposable items, and they imagine that they are not transferring infections when in fact they are. So things like hand hygiene could go down if you feel like you're dealing with the problem by using more disposables. So, adherence to good infection prevention policies and things like hand hygiene, those are all things that are better at preventing infections than reliance on single-use, particularly plastic items. I think the second item in particular is, are there more sustainable alternatives? And anything that is durable, even things like dishware, are important to take a look at. Reprocessing, there are single-use items, I'm sure you all know this, that can be perfectly safely reprocessed through companies that offer that service. It's a certification that they are able to reprocess it. It's perfectly safe from a quality and patient care standpoint. And what's interesting to me is that the clinical settings that have really ramped up processing, they've optimized the number of things that they reprocess. It saves a lot of money. And not that you're in this to save money, but it can save $1 million a year in an average hospital if you optimize reprocessing. Yes, it takes operational process flow changes, and that's where you can come in. If you can advocate reprocessing and you can help determine what process flows will work in the department to make it possible to do this, you are significantly reducing the carbon footprint, you're reducing waste, you are addressing climate change, and by the way, you're saving money. And then the last item, back to, surgical kits, but also just procedure kits that are used in outpatient settings. It's not just the stuff that's in the kit, although that is a huge opportunity to optimize, to reduce what is not frequently used. But also to look at packaging. There are huge opportunities in just, why is something packaged twice? The big packaging, and then the packaging so it can sit on a shelf in the supply room. And taking a look at your supplies and questioning that, and approaching the supply chain and procurement group to advocate for changes in this. Clinicians are the most powerful people at getting changes like this to happen. I mean, I know, because I come from the sustainability side of things, where I'm trying to push these things into clinical care and into supply chain. And I learned quickly that if I had a doc on my side who was able to say, here's how we can make this happen, and be the one to champion it. It's just like you'll probably hear with anesthetic gases. You need an anesthesiologist who can dive into this and advocate for it among their peers, and it makes all the difference in the world. So a couple of other things I just, as I wrap up here, looking at lower carbon care, we're going to hear more about inhalers in a moment. We already talked a little bit about plant forward food, but for patients, so to the extent that you can advocate healthy eating to your patients, if you're not comfortable talking about the climate impacts of that, focusing on the health impacts is plenty. Telehealth is a huge opportunity. And again, it's not measured in the same way as some of these other things around emissions, but it's another one of those things with telehealth where a lot of people prefer it. People can get care more effectively. They don't have to, lose a shift of work to come in for an appointment because they can get a telehealth appointment. All the things that go along with alternative ways to provide care, especially telehealth, can be lower carbon care. One more thing about telehealth, just to mention it, is that there have been a couple of studies that point out that people are having health issues dealt with sooner than they would have been caught otherwise, because they were able to get health care through this avenue, as opposed to waiting until it was serious enough for them to go in. And the last item I want to mention on this slide is a circular economy. And all that means is, instead of, I talked about that supply chain where you get the raw materials, you make something, you transport it, you use it, you throw it away. Instead of that chain, circular economy means that from the very first stage, you are thinking about how those raw materials will be reused again in a cycle, so that materials can be endlessly cycled. You're not starting with that end of life in mind. You're starting with, how am I going to get this back again so I can use it in more products? And that's promoting circular economies is part of what supply chain folks are spending a lot of time on. So my second to the last slide here, I just want to close out with some resources, but I wanted to again say, one of the most exciting aspects of this work is the opportunity to drive better care delivery. And someone mentioned it earlier, physicians are trusted messengers. There's actually Ed Maybach, who is at George Mason and has been working for couple of decades on communicating about climate change. He recently shared a study looking across the political spectrum, from very liberal Democrats to very conservative Republicans. And what do you think was in the top box across all of those messengers? Who they trust to talk to them about climate change? It's physicians. So no matter where on the political spectrum, physicians have enormous power in this space. You also have the moral agency, meaning when you talk about right and wrong, you are a respected, credible voice for that. And if pollution is wrong and better quality care is right and a lower carbon footprint is right, those are all things that, as a trusted messenger, that you have the moral authority to communicate. And I was very pleased to see earlier somebody talked about that multiplier effect. It's usually referenced in terms of the negativity because, the climate multiplies the effects of diseases and health impacts. But there's also the positive side of it, which is that you can work within your community, your physician community, clinician, your healthcare system, your regional community, and that has a positive multiplier effect as you bring some of these actions to bear. So you can catalyze change, you can lead climate action, you can educate patients, colleagues, and others in a very exciting and meaningful way. And so I do have some resources, and you'll have access to these slides and these links. We've heard many of these mentioned already, but I would recommend that in addition to what I showed earlier, like Choosing Wisely Canada, that you tap into these resources. And so just in closing then, I'm going to go back to the 3 questions I thought I wanted you to contemplate. And that is, what responsibility do doctors have in mitigating environmental impact of healthcare? How do you think about the principle of do no harm as it applies to climate change? And what adaptations should doctors and other clinicians make in addressing the health risks related to climate change? So those are my questions to you. And now I am very happy to take any questions and comments anybody would like to make.
Hi, I'm Alex Brooks. I'm a climate and sustainability coordinator for the city of Boise. And I was really interested to see the scope 1, 2, and 3. And when we work with community facilities, we usually focus on scope 1 emissions because they're the most accessible and easiest to change. Scope 3 tends to be more complicated. And so I'm wondering if you've seen any successes with Scope 3 sustainable purchasing choices that are kind of like a gateway to, that are easy, low-hanging fruit that then open up to more sustainable purchasing practices.
Yeah. Well, in fact, I think somebody is going to be talking about a reusable gowns project in a moment. And that is one that I consider sort of low-hanging fruit because the reason is because there are lots of other advantages. It turns out that with reusable gowns, there's an increase in comfort on the part of clinicians instead of that plasticky thing where some can get hot, people feel cooler. So there are other advantages to reusables that get lost when you're only focused on, I need to dispose of something because I think that's better for infection prevention. So looking at something like that, any kind of reusable linen. The other thing to do is there are Practice Green Health and Healthcare Without Harm. Some of the resources I listed earlier, they have EPP protocols and templates that are readily available. I mean, one action would be just to start with that and say, here's what we want, suppliers, even if you can't give it to me today. We're starting to communicate about what we want the supply chain of the future to offer us. So that's also important. And then the last comment I'll make is people who've had success talking to their procurement teams and asking what contracts are coming up. So, products have a certain contract period. And if you find out that there's a particular disposable product that is coming up for review and bid, that's a perfect time to get in there and say, let's talk about that one and focus on the environmental components of it while we're also meeting the quality, efficacy, affordability. I mean, knowing we still have to meet all of that, but let's include environmental considerations as we talk to suppliers who are coming to bid for that product. So those are a couple of thoughts.
Hi, my name's Lucy Skinner. I'm a family medicine resident. I was just wondering, one thing that we've had a big issue with is insurance coverage of certain products, specifically inhalers, and we've had a big push in our clinic system to try to switch to more DPIs, but certain inhalers aren't covered by Medicaid. They'll only cover one type. And so have you had any success in your career, like working with insurers or getting buy-in from insurance to kind of focus on climate initiatives?
Yeah, that's such a great question. Actually, I do work with a group of insurers, several public agencies. In fact, in Oregon Health, they are doing some innovative work around a Medicaid waiver where it allows use of funds to buy air conditioners for people who are most vulnerable on high heat days. So the Medicaid waiver program for a public agency is worth looking at. And Oregon's example in particular is really heartening there. In terms of private payers, what I'd say is that they're in the very earliest stages. I am working with some of the biggest, and they're in the very early stages. I mean, their drivers are, they see costs going up because of health impacts of climate change. So they have a motivation to understand how is climate change impacting utilization of healthcare services? What does that mean as you forecast that into the future? And what can be done to try to get ahead of that? They don't want to get caught flat-footed like property insurers when all of a sudden, people like me had my insurance canceled because I live in an area prone to wildfires. So they are trying to get ahead of it, but they're at the beginning stages. So honestly, other than the Medicaid waiver that I mentioned, and just talking to the insurers who have some of the most market share within your local area, to ask them what they're up to, and providing with some of these suggestions is going to be important. So I wish I had a better answer for you than that, but that's my experience currently.
And we'll be hearing from some pharmacists from St. Luke's that'll be talking specifically about the DPI availability in our region, because it is a very region and insurer-specific issue that there's not a great national solution to as of yet. But a lot of physician-led work has been done on a national scale to try to get insurers to provide coverage for these lower carbon inhalers. I want to thank Kathy so much for her time. We are going to take a quick 15-minute leg stretcher, shake off the funk of post-lunch hangover, and then we'll come back with some examples of how people in our community have instituted some of the really innovative solutions that Kathy has touched on in healthcare practice here in Idaho. I just would like to put in one additional plug for something Kathy had on her list of resources that just occurred. Then I got to see Kathy in Atlanta at the Clean Med Conference. It really is an inspirational 3-day conference that's offered every year that will teach you a ton about the different sustainable innovations that are happening throughout the supply chain, throughout pharmacy, throughout food and nutrition, building services, and a lot about how clinicians can be involved in all those things to reduce the carbon footprint and improve the quality of care, with quality always kind of being highlighted as the focus in that organization, because it's run by Healthcare Without Harm and Practice Green Health, these two organizations that are really dedicated to this issue. So get up, maybe go outside and get a quick breath of fresh air. And in 15 minutes, we'll have Dr. Deutsch talking about transitioning from desflurane to sevoflurane.